The Emotional Storm, Understanding and Managing Borderline Personality Disorder, BPD. Borderline personality disorder, BPD, is a complex mental health condition characterized by pervasive instability in moods, self-image, and behavior. This instability often disrupts relationships and daily functioning. BPD affects approximately 1.6% of the adult population, although the number could be higher due to underdiagnosis. Understanding BPD requires delving into its symptoms, causes, and treatment options. The symptoms of BPD can vary widely among individuals, but they typically fall into several key categories. 1. Emotional instability. Individuals with this condition often experience intense episodes of anger, depression, and anxiety that can last from a few hours to a few days. These mood swings are more severe than the typical emotional ups and downs that most people experience. 2. Interpersonal relationships. People with the disorder tend to have unstable relationships with family, friends, and loved ones. They may swing from extreme closeness and love, idealization, to intense dislike or anger, devaluation. This pattern is often referred to as splitting. 3. Self-image. Those with BPD often have a distorted self-image or sense of identity. They may suddenly and dramatically change their opinions, values, career plans, or types of friends. 4. Fear of abandonment. A deep fear of abandonment, whether real or imagined, is a hallmark of this disorder. Efforts to avoid real or imagined abandonment can lead to frantic actions and extreme behavior. 5. Impulsive behaviors. Impulsive and often dangerous behaviors are common, including spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. These behaviors are usually efforts to cope with stress or emotional pain. 6. Self-harm and suicidal behavior. Self-injurious behavior, such as cutting or burning, and suicidal thoughts or attempts are unfortunately common among those with BPD. 7. Chronic feelings of emptiness. Many people with BPD experience chronic feelings of emptiness or boredom, often feeling as though they are misunderstood or separated from the world around them. 8. Intense anger. Inappropriate, intense anger or difficulty controlling anger. For example, frequent displays of temper, constant anger, recurrent physical fights, is another significant symptom. 9. Paranoia or dissociation. Some individuals with BPD experience transient, stress-related paranoid thoughts or severe dissociative symptoms, feeling cut off from oneself, observing oneself from outside the body. Causes of BPD. The exact cause of BPD is unknown, but researchers believe it is the result of a combination of factors, including 1. Genetics. Studies suggest that BPD runs in families. Individuals with a close family member who has BPD may be at higher risk of developing the disorder. 2. Brain structure and function. Research has shown that people with BPD may have structural and functional changes in the brain, particularly in areas that control impulses and emotional regulation. However, it is unclear whether these changes are a cause or result of the disorder. 3. Environmental factors. Many people with BPD report having experienced traumatic life events, such as physical or sexual abuse, during childhood. Other environmental factors, including neglect, separation, and unstable relationships, may also contribute to the development of BPD. Personal anecdote. I once had a friend, whom I'll call Alex, who struggled with BPD. Alex was one of the most passionate and engaging people I knew. However, his relationships were often tumultuous, marked by intense emotional highs and lows. There were times when Alex would be full of life and laughter, making everyone around them feel special. Yet, in moments of perceived rejection or abandonment, even over minor issues, Alex's mood would drastically shift to anger and despair. Watching Alex navigate his emotions was heart-wrenching, but it also gave me a deep appreciation for the struggles faced by those with BPD. If you found value in this video, please give it a thumbs up, like and subscribe to support this channel. Please share across social media platforms to reach a wider audience. Diagnosing BPD involves a thorough clinical evaluation by a mental health professional. This includes 1. Clinical interviews, a comprehensive interview with the patient to gather information about their symptoms, medical history, and family history. 2. Behavioral observations. Observing the patient's behavior and interactions can provide valuable insights into the patterns of instability typical of BPD. 3. Self-report questionnaires. Tools like the Borderline Personality Disorder Checklist and the McLean Screening Instrument for BPD can help in assessing the presence and severity of symptoms. 4. Diagnostic criteria. The diagnosis is made based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which requires the presence of at least 5 of the 9 specific symptoms associated with BPD. Treatment of BPD. While it can be challenging to treat, many individuals experience significant improvement with appropriate treatment. The main treatment approaches include 1. Psychotherapy. This is the cornerstone of treatment for BPD. Types of psychotherapy used include dialectical behavior therapy, DBT, developed specifically for BPD. DBT focuses on teaching skills to manage emotions, reduce self-destructive behaviors, and improve relationships. Cognitive behavioral therapy, CBT, helps individuals identify and change core beliefs and behaviors that underlie inaccurate perceptions of themselves and others. Mentalization-based therapy, MBT, aims to improve the ability to understand the mental states of oneself and others, enhancing interpersonal functioning. 2. Medications. There are no medications specifically approved for BPD, but various drugs can help manage specific symptoms, such as mood stabilizers, antidepressants, and antipsychotic medications. 3. Hospitalization. In severe cases, short-term hospitalization may be necessary to ensure the safety of the individual and provide intensive treatment. 4. Support groups. Participating in support groups or therapy groups can provide individuals with BPD and their families with education and emotional support. Living with BPD. Living with BPD can be incredibly challenging, both for those who have the disorder and for their loved ones. However, with the right support and treatment, many individuals with BPD lead fulfilling lives. Here are some strategies that can help. 1. Developing coping skills. Learning and practicing healthy coping mechanisms for managing stress and emotional distress is crucial. Skills such as mindfulness, distress tolerance, and emotional regulation taught in DBT can be beneficial. 2. Building a support network. A strong support network of understanding family members, friends, and mental health professionals can provide emotional support and practical assistance. 3. Self-care. Prioritizing self-care activities, such as regular exercise, healthy eating, sufficient sleep, and engaging in hobbies and interests, can improve overall well-being. 4. Setting realistic goals. Setting achievable goals and taking small steps towards them can help build confidence and a sense of accomplishment. Reducing stigma. Reducing the stigma associated with BPD is essential to improving the lives of those affected by the disorder. This can be achieved through education, advocacy, and open conversations about mental health. It is important to remember that BPD is a medical condition, not a character flaw, and that those living with BPD deserve empathy, understanding, and support. Borderline personality disorder is a severe and complex mental health condition that affects many aspects of an individual's life. Despite the challenges it presents, effective treatments are available. With the right support, individuals with BPD can lead meaningful and fulfilling lives. By increasing awareness and understanding of BPD, we can help reduce the stigma and provide better support to those affected by this disorder. In crafting this video, the goal was to provide a comprehensive overview of borderline personality disorder, incorporating clinical insights with personal anecdotes to make the information more relatable and engaging. The story of Alex, although anonymized and generalized, is inspired by real-life experiences and serves to illustrate the profound impact BPD can have on individuals and their relationships. If you enjoy this video, please give it a thumbs up, like, and subscribe to our channel for more self-improvement videos. Comment below to tell us how useful you found this video. Remember to share on various social media platforms to reach a wider audience. Click the notification bell to get notified anytime we post a new video. Thanks for watching, see you in the next video.